That camera cost. Oh shit! That camera cost. The camera itself, the body is 2,000. The lens is 600. It's not the most expensive lens. I have other lenses that are 1,000 each. They're expensive.
Damn.
First off, what's your
Dude, I'm
position?
just so shocked. I'm shook it, like the young kids like to say. I'm shook.
Yeah.
Dude, it really is crazy though. I would have never expected to be in this type of situation. I thought this like only happens in movies.
It does, right? It does feel it's weird because this whole situation, I kind of
Situation.
how when did you expect this to happen? Like when did it actually hit you that something was happening right now?
It's so crazy because when this all started to unravel and happen, I was in Michigan.
Oh, okay.
And I already had booked my graduation gift to Cancun.
Oh shit.
So I flew
My
out.
graduation gift. I bought it myself.
I bought it myself for my gift. No, because I was going to treat myself and I wanted to go to Cancun. And I booked the trip. And so I left right when it started happening. So I'm like, I'm going to get stuck in Mexico. Like, they're not going to let me
Wait,
get on
you
the
left?
plane.
Like, you took off?
Yeah, I took off in March, the
And
first
you
week
were
of
in
March.
Mexico?
And I was in Mexico.
Oh, shit.
But there were so little cases, confirmed cases in Mexico. I'm like, at this point, it's safer to be in Mexico than in the U.S.
Yeah.
But then I got back. And
when was that?
I got back like the second week of March to Michigan.
To Michigan.
Dude, in the news, Michigan was ranked the third state with the most confirmed coronavirus cases.
It was mid-March.
New York, New Jersey, and then Michigan.
Oh shit.
It was crazy because I'm like, what? Like, and I never went. I didn't go back to work. I sheltered. We were at home with my roommates and everything. And I was working from home, but it was crazy because I'm like, how is Michigan the third state that has the most confirmed coronavirus? And a lot of it was because of the international airport there in Detroit.
Oh, okay.
So that was one of the
Detroit.
biggest. That was one of the biggest reasons, right?
Get close to my.
So that's what happened. Like that was that's where I was at in this whole situation, and I was in school over there, and I realized I'm like, dang, I'm just working from home. I do that anyways. So why not just get a head start? I was planning to either move to New York or to California when I graduated, but I figured I'd just come back to Texas for a little while. And so I came back and I drove.
You drove?
I drove from Michigan.
How was
here, and
Michigan's situation like?
It was very calm when compared to Texas. Surprisingly, like I was still going to the stores, but no one was wearing a mask. Like, although there were the most confirmed cases, the county that I was in, there was very few cases. And as the university kind of shut down, and then everybody started going home. So it was really chill.
You went to Cancun for spring break. It was during that.
It was the week after spring break for our school.
Yeah, it was relatively calm during that time.
But people came back from spring break and they didn't go back to classes.
Yeah,
everything went virtual.
That's when everything started going. I want to talk about, because here's the thing about our situation. We are in South Texas. Like the biggest places that are being hit right now is what? New York? New York. Not even California. I think it's basically just New York. Some parts, maybe I heard
because it's so congested there.
Yeah,
because there's so many people.
Yeah,
and there's a lot
so
of
bad.
But it started in Washington.
Oh yeah, that's true. In a nursery home.
Yeah.
In a nursery home in Washington. You're right.
But people were saying that the virus was already here even before that.
No, yeah, I mean,
how is it? It was not.
That's the speculation.
February. Like it was before that.
Yeah.
I really do think it was, and they just didn't catch it because they thought it was in China. They all just thought it was going to be in China, and that it was.
That's the speculation I want to kind of discuss. Is what do you think? How we're reacting to?
Honestly, I was.
Let me rephrase this, because I sounded like an idiot. How do you think? How would you rate the way we're reacting to the virus?
Dude, at the beginning, a lot of people thought that it was a hoax. They thought it was fake. They thought it was not real. They thought it was just like a way to get more media coverage, ratings, and then all that stuff. And I have friends from China, and when that was happening, I started to reach out to my friends in China because I wanted to make sure that they were okay.
In China?
Yeah, I have friends in China.
Okay.
So I reached out and I couldn't get a hold of one of them. But then my other Chinese friend, I was asking her about it, but she was in Boston, and she's like, I'm like, my family's good.
Is it racist to say Chinese friend, or is it Asian friend?
No, she's Chinese because she's from China.
Oh, okay.
Yeah. And so I was checking up with them, and they told me that it was fine and all of that. But I was still even before all of it started, I was already in my mind thinking that this was gonna be like, for some reason I felt that it was gonna be a big thing, but I was checking up with my friends and I was making sure that they were okay, because I knew that it was having a direct impact in people that I cared about. And elderly people were getting affected in China, and young, like everyone was being affected, in poverty, humble communities were being mostly affected too.
Yeah.
So I was kind of offended with things on Facebook that people were posting,
regarding
all the
Chinese
memes,
and whatnot.
the Chinese and all the memes about like coronavirus and here we go, like just racist things and belittling the situation and minimizing it. I'm like, you all have no idea that impact that it's having. And I was so upset. I was telling my friends, I'm like, y'all are not taking this seriously. And
So
that's
your
not
position was serious. Like
I
you
was
were
serious at
like,
the
okay,
beginning.
this is something serious.
People are dying because of this thing, and people want to make fun of it on Facebook. Oh my God, 1 week, 2 weeks passed, and then it's like, oh, it's in the US. And everybody started freaking out. Then, oh, this and that. And I'm like, ugh, because sometimes people won't. I was just the whole thing. I was kind of disappointed in people's reaction to it at the beginning. Even if it wouldn't have turned out this big, people should still have had like the common courtesy and like the humility to be like, hey, there's a country that's being affected by something and we don't know what it is.
Yeah.
And if you want to make fun of it on Facebook and be ignorant and be
I don't mind the memes. I don't mind any of those. I mean,
it's not like there's kids. There was people dying.
I know
you're making fun of a virus, like.
I know the whole humor thing, like making fun of the situation to kind of like ease it, like that whole comedy sideline.
I will say this though, and I don't care who I offend. People who were sharing stuff, it wasn't because they were just they were trying to be funny, but they're stupid. They're dumb because they didn't know. I was like, dude, you're being so dumb.
There's a way to do it.
Yeah, there's a way to do it, and that's not something you should be making fun of. Like it is affecting people. People are dying.
You know what? You're right. Because
I'm all about memes. Like I'm all about it, but there are certain things that are like, whoa, like you're really
kind of
going there.
Insensitive because people are dying.
Yeah, and I didn't want to say this, and I'm like, until you directly get affected by it,
that's when it matters.
But I was like, I'm not even gonna put that into the universe for nobody because that's not fair.
Yeah.
But damn, you like don't be stupid if you don't know about it.
You just spit on my mic, bro.
I'm sorry.
That's
disgusting. There's like this little protection. I'm
joking.
very passionate about this topic because it's important to educate people on certain situations, like to know that that's not something that you make fun of.
No, and it's true.
But they didn't know any better. But still, it does not give anybody a pass.
That's always I think that's always the situation with anyone, with the fact that we don't know, that unknowledge. And because people don't know, they want to always kind of resort to reacting a specific way, which is, and it's not, they always take like the best way possible. You know what I mean? So like, because they don't know the whole situation, they're not keeping up with the news in other countries. They want to start reacting in an insensitive manner to kind of,
it's probably even insecurity too.
Yeah, I mean, there's a lot of things.
They don't know anybody.
I actually kept up with the news before it actually happened. With that the daily thing, they were covering it extensively for a month, I think, or 2 months before, and actually going out. And they even mentioned how in November, I think, they were getting little clusters of this pneumonia-like illness that was affecting, and they didn't know what it was because it was kind of causing severe outcomes. So the current situation where, right now, we're still in the pandemic, that's a thing, but they're easing restrictions. And a lot of people are acting like nothing's happening. That's one of the things that I think we're kind of overlooking. Is, I was having a conversation with my friend, is that you kind of forget what it is, like why we're kind of locked down. It's not because, oh, this thing might kill you. It's because of how infectious this disease is, how quickly transmissible it is. That's why. And how long it stays. The flu, you get a flu. If I had the flu right now, right? And this is one thing they like to compare it to a lot of people. And I don't blame it. It's basically the flu. It's a illness that is a coronavirus, right? It's a coronavirus strain, and this illness attacks the respiratory system, just like the flu does with coughing, and it has the same symptoms. But the problem is that the flu, if I had the flu in 1 to 2 days, you'd exhibit those symptoms, and then immediately you'd say, I can't go to work because I have the flu. I'd go to the doctor, to get tested, and then right afterwards, you would obviously have that decency to kind of refrain. The problem with this virus is, and as everyone knows, is that it's like most of the people, 96, I think maybe even 96 and above % are asymptomatic, which means you're not exhibiting any symptoms at all. And that's the issue.
That is a big issue. And another big issue is that there's like no vaccine to it.
Yeah, that too.
It's like they don't
And it's new.
It's new.
So no one knows what the fuck's happening. No one knows. I don't know. And to act like you know, like the way I like to act regarding how we're reacting to this and how I'm taking, like when I showed up, dude, I had a fucking mask on because I was like, I know it's weird at this point, right? Like it's kind of weird to show up to a friend's house. You agreed, you asked him, but I'm taking that initiative to kind of cover myself up, investigate whether this guy has a cough, see if anyone else has a cough, how the kind of the temperature. They say it's time to fuck around. So
I don't know. That was good that you were taking all that precaution.
No, and then I took off the
I
mask,
was also
obviously.
precautious. I'm like, I'm letting a guy in my house that is dating or that his wife works at the hospital.
Yeah, she works at the ER.
I was a little bit scared
She
too.
works at the ER, yeah.
I was scared.
No, I know.
I'm still scared.
No, but the cool thing about that,
Not scared, but I was like,
no, it's alarming.
Yeah.
I guess the cool thing
I'm
about
like,
yeah, no, I get you. The cool thing about the fact
like,
that the cool thing about the fact that if you do that one more time, I won't slap you. Okay.
yeah, it's
I'm
crazy.
touching
We
it.
have to be careful, like we do. And look, I would be
But
honest
we're
with
not
you.
getting affected in the hospitals though. Like the thing is, Kathy, that's my wife's name, and she works at the ER.
Shout out to her
Yeah.
and her service. No, I'm being.
Yeah, no, thank
why
you.
are you laughing?
Because
honest,
here's the thing,
That's
there-
a risk.
it
and
is.
she's
No, it
serving
is.
the community. So,
You're right.
You know, shout out to her and my aunt also, who is also a RN and she works in the hospital.
The thing is, I feel weird because, like, here's the thing: you, and I don't mean to demean them. Like, they're doing an awesome service, right? It's their job, though.
they're getting paid for
They're
it.
getting fucking paid
No,
for
but
this
they're
shit.
also
And then,
risking their lives.
They
right?
are.
And
they are.
but not.
I
but
think they
do
should
it
get
every
hazard
day, though.
pay. I think they should get hazard
They
pay.
should be getting lots of benefits, just like teachers should
Yeah,
be,
no, they
and I
should.
think they're underpaid and all
Because here's the thing, I know the whole
another
unemployment. Yeah, well, no, I mean we could be whatever you want. The whole unemployment thing, where people are getting $600 on top of their check. Mm-hmm. I think like unemployment benefits.
Yeah.
I don't know why they didn't do that to nurses or people working in the medical field.
I mean,
what?
well,
what
because is the money's to help people that that are either not working,
yeah.
But they all got a stimulus check, didn't they? Though,
Did they?
well,
they did.
yeah,
No,
they got at least that.
Well, they got that.
Because
But what about
unemployment is
hazard
something
pay?
different. Well, I mean that's different. I mean, not that it's different. Like maybe like I'm saying,
That's
it's
what I'm
different between the unemployment and then the hazardous pay and then the stimulus
Yeah.
check, right? Like so.
I think they should get
So it
hazard
would
pay.
be for like a reward system.
No, it's more of a.
You just want more income coming into your house.
I do.
Okay.
I need fucking new lens, bro.
Yeah, no, 'cause I mean, it's
here's the issue. Here's
You're,
what.
not that you're getting, not that it's a greedy thing, but
Yeah.
I feel like would there be enough money to also pay for that? And
I don't think.
not in a greedy. I'm not saying
Yeah,
it's
no,
greedy.
no,
I'm
no.
just
I don't
saying,
think
like,
there isn't. Here's my thing is that if let's say you were working in a medical field, right?
Yeah,
This coronavirus is happening.
yeah.
Honestly, if you were to put yourself in those shoes, what is keeping you from saying? And a realistic question, not a sarcastic question. Like answer it. What is keeping you from saying, you know what, I don't want to go in because I'm afraid I'm going to catch that virus?
The thing is, it doesn't matter if it's $600 or like $6,000 or whatever the amount of money is. Like, it's still not going to change the situation or the way that I feel about going into work. Like, my life and my health is way more important than any type of like
But wouldn't it feel
monetary
better?
number. Maybe, I don't know. No, like, well, maybe
If I give you
it's
$600 right now, would you feel better about doing this podcast?
Dude, I'm not even trying to be like this humble guy that I don't need money and none of that. No, like I really am not trying to be that guy. But when I got the stimulus check, I'm like, wait, first of all, do I have to pay this back because I don't need the money? I was in I've been in a good situation where I didn't need the money, and I'm like, I know everybody should get money, but I'm like, maybe somebody else needs it more than I do.
Yeah.
But I'm also not gonna just donate it to somebody. You know what I mean? It's like I'm
Fuck
happy
that.
that it's in my bank account and I can
no,
put
of
it in my
course.
savings, but
You can put it towards something, yeah.
I was thinking like, well, do I really need it? Like, give it, do something else with it. But there is people that do need it.
Mm-hmm.
So if they could give the money, great. But I really don't think that would change anything. I don't know. Maybe if we had somebody here that could talk
Hey,
about it, that
$600
would
can
be,
go a long way. I know if Kathy got $600, and this is just because I know her,
Yeah.
it would help with the bills. Cause I don't pay for her shit. Fuck that. No,
No,
no. Look, I help her out, but I know as a person, if she got $600 and I know her well, she would be like, "Oh fuck, I'm gonna go spend it on some clothes or something." It's better motivation to keep working in that hazardous environment. Because believe me, the conversation has arisen. Like, dude, do you think you should stop working? Do you think you should stop working? Because
But the monetary thing, what, like, how's, I totally get, if you don't want to work because you feel that it would be an unsafe situation and then you have to come back and you have kids, like, then you have, but I don't know what the penalization is for that. Like, will you get penalized for that or not?
Or I think it's different companies. There should be protection, right?
There should be protection, but
okay.
To me, dude, honestly, it wouldn't make a difference, like, the money part, like, I mean, I know that it would make a difference, but I'm saying no amount of money would change the situation that I'm going into work risking my life.
Do you think people are going to shit on you for this?
No, I think there's people that are going to agree with me.
Like,
because I'm not sure. I'm just saying, like, if
it's
you have the money,
opinion.
great. Yeah, you should be giving them bonuses and money, and we should be contributing to their work that they're doing because they're helping people. They're saving lives. I just don't think if I was a nurse, like, yes, great, $600 could make a difference, but I'm just saying it would not change my feelings about going into work. No amount of money. It's like, if I felt unsafe and I lived with elderly people with my grandparents,
you would stop.
I would probably stop because I wouldn't want to risk that.
Well, I mean, there is unemployment.
Well, I have a friend who quit her job and she applied for unemployment and she didn't. They denied it.
Did she put the reason why? Like, because, like, concerns of personal
Well, it wasn't even none of that. It was just she quit her job and...
Well,
she moved back and she couldn't, like, she applied for unemployment, but they're like, well, you quit your job. You weren't laid off or fired.
That's where I think they should, if they haven't already.
All these like people that are, like, for example, old people that work in the refineries and they came back there, like, they got laid off because they closed the things down. So they qualify because they had no choice in the matter.
Figuratively speaking, right? The people who are kind of handling this whole situation for us, and I'm actually, the fact that, companies are kind of rewarding them, like, by giving them free shit, and
so Kathy didn't get, like, a raise or anything, because I know other businesses, no. They're like, oh, because you're working, like, HEB.
I don't want to disclose her amount of money she makes, but she makes
but she makes
drastically less than me. Drastically.
Okay, well, it depends.
And my point is, we're worried about her bringing shit to the house. That's the thing. Every time she gets home,
like, is the risk worth it?
Exactly.
But the risk would be worth it for $600 more.
I think it would put me at ease a little bit more. I know, especially for her, because I mean, think about that's for in our perspective, $600 is more than half the rent.
Yeah,
and light.
To be honest, I don't even know. Like, I'm not even trying to be like, I don't know.
I think it's a matter of perspective.
Yeah, because I don't live with her. I don't live in that situation, so I don't know. But I'm saying if I was in that situation, no amount of money would make a difference. It would help, but it wouldn't I would still be scared to go to work. And there's been nurses that don't want to risk it, and I totally respect that.
Yeah, I think amount of money would help, though. I mean, I don't want to, like...
Well, you're in that situation, so you know more than I do.
You're going to tell me that if someone offered you, and I'm giving you I'm not trying to be a smart ass, I'm giving you a big ass number specifically to kind of prove your point wrong. You wouldn't go with more ganas to work if they gave you $100,000 bonus, and your regular salary was, $30,000 a year.
If I have to choose between my livelihood and my health, no amount, like I said, I'm gonna stand by. No amount of money would change my emotions or feelings towards the situation. I would still go though. Like, I think I would still go because I think, don't they make an oath?
I find it hard to believe,
they
dude.
make an oath.
How do you for real would choose your life over money? I guess that's what I'm saying, right? Like, damn, that's...
Well, I'm in a comfortable situation where I don't depend on money. Like, I know that you have to have money to get around and live your life. Yeah. But for the last 2 years, I've been living on a budget. Yeah. That she should get rewarded and get more money. I'm totally about that. Like, because even HEB employees got a raise, like, per hour.
Yeah, that's what I'm saying. Like, something. Like, even if it's a gesture. You know what I mean? Yeah. Like a gesture of gratitude. My point. Have you been hearing that there have been fake coronavirus deaths, or like associating deaths that were happening for other reasons with coronavirus?
I've heard a lot of things, and one of the things that I'm gonna go to this is that, dude, people are dying anyways already of other things. Yeah. So these deaths,
like, specifically,
some people can't even say, like, oh, well, this person died because of the coronavirus. Like, maybe they died because of something else, because people die already on the daily over other things. So are those deaths?
No, okay. Well, like, a more specific example. I've heard reports of where someone went in for a car wreck and then later died because of the car wreck, and then they labeled them as COVID-19 deaths. That's
what I'm saying. Like, there's people that have died of other things, and they're probably being like, oh, well, they died, and so they're that. But I don't know. I mean, that's a lot. Wait, so what's your point, or what's your question on this?
Like, what's your take? Like, do you think that's true?
that people are being like put into the deaths
category
of
that you
corona.
died like that. Like, let's say, I don't want to be. I'm just trying to
I
like
mean, it
label
would be unethical to be doing that.
right. Like, but do you think that's happening?
I mean, it's hard to say. Like, maybe it's happening. Like, it shouldn't be happening, but maybe it's happening. I don't know how
Yeah,
to say. Like,
I heard it was. I heard it. Well, obviously, I heard, and there's a lot of reports as far as like all these types of posts.
But why would you? What would the benefit be of that?
Specifically,
Yeah,
if
like
it,
of labeling that as a
the
coronavirus.
the
case.
problem with nowadays when people want to think of like all these terms and like all these like issues that are happening, like for example, this pandemic, is that it's isolated. It's just a pandemic. A lot of times we fail to see the connections between all of these different situations, right? And the sheer fact is that hospitals are getting affected because they're businesses. They get less amount of people, so they get less amount of income. They have to fire people. They have to do all these things. I don't know if you knew, but hospitals get benefits from the government depending on COVID-19 counts and deaths. So let's say if someone gets put on a respirator for COVID-19, they'll get $35,000. Like, I'm just putting a number out there. I'm not sure if that's exactly the number, but I'm putting a number out there. Let's say someone gets diagnosed, they get $3,000, just a simple diagnosis. Treatment, $10,000, you know? And a lot of the speculation, or maybe it's not even speculation, maybe it's just what it is. And a lot of times we want to look at it as a conspiracy. But they're trying to find ways to kind of get their income from somewhere else. You know what I mean?
So I totally get it, and I think a lot of organizations find a way to just work with the system. And like I said, that probably is happening. I don't know but if I worked at a hospital and I knew that was going on, that'd be unethical.
No, it isn't.
At the end of the day, right? Like, it's just unethical.
Did you see that video of a Facebook nurse? She was like saying they're labeling people for COVID-19 deaths for this, and they came in for a car wreck, and it's kind of messed up. And
So because back to really quick the question, because I totally get that might be happening, but the point was that, is it you think that they're also doing that? Like, is it wrong because they're reporting those cases and people are scared, thinking that there's more deaths of the coronavirus than there really is?
It's. I think the point I'm trying to make is that in this situation, right? Because we saw what was happening in China, Italy especially, all these places. We know it's serious, right?
Yeah.
And when you mix in the whole hospital miscounting deaths, it lessens the credibility of what it is. So when someone who doesn't read the news sees these posts where they're fucking faking COVID-19 deaths, the next thing they're going to say is, well, this is just a fucking scam. Why am I going to believe this? Like, there's no reason to trust everything else because they're faking the numbers in the hospital.
Dude, well, that's another point that I'm glad that you brought up, because people need to educate themselves, right? You saw a Facebook video, and
Yeah.
I'm not saying that Facebook, they also produce content, and there's
Yeah, no, they do.
algorithms that go in it, and they're going to share the video, and they're going to like it, and they're going to comment it, and the more views it gets, the more attention. So like, dude, I wouldn't even count on a Facebook video to, first of all, even give me the right information, but I know that you do your extra research. I totally get that. But one situation like that, like, I think that's what bothers me about people, is that they think like, oh, just because I heard that one thing, now all the other hospitals that are doing it, it's probably the same thing, right? And that's so not fair, because there is hospitals that are acting ethical, there is states that are doing ethically, and then one little bad apple kind of just
ruins a whole bunch. Yeah, and
but I think that's fair. And when you were talking about that, I don't know if you were seeing all the protests that was happening in Michigan.
Yeah, like about the anti-lockdown protests.
Yes, it's like they wanted to come back to work. They want to go back to work, and who cares if they get sick? Like, it's their choice, it's their freedom. And I know a lot of other people that are like that too. I'm like, why are you being so selfish? Like, oh, I don't want to file for unemployment, I don't want to work. Like, it's not about you. Like, it's about other people that are going to be affected by it and don't have the proper health care, that don't have the financial income, that just don't have the luxury to get sick or to experience that. I totally understand that you want your freedom and you want to be able to just work, right, and get out of the house and not be on lockdown, but it's not fair to
be selfish.
Exactly.
I think that's one of the problems with
they don't be selfish, be considerate of other people.
There was also a scandal regarding that, and the Daily covered it. I don't know if you saw the news post, the podcast episode, but they were basically discussing how those lockdowns were actually funded and encouraged by interested parties. I'm talking about big, heavy parties.
Oh, I know. Yeah, I heard
heavily
about that.
funded parties.
Yeah,
Like,
whatever.
boop, like a cut.
Yeah.
Yeah, I know, and something like a kind of connected. Going back to that.
So yes, I did hear about the funding.
Yeah, the vast
part.
majority. A lot of people think like, oh, people are going crazy but it's a small population in the percentage of the general consensus about what we all think. And the problem with that is when you focus that magnifying glass on that small population, you assume that we're not all happy, which incites more like discomfort. Like, hey, there's more people who think like me or remotely think in that kind of small aspect. So I'm going to follow that same ideology and want to kind of step out.
I totally agree, and I think it's kind of ridiculous because it's the media also with what they're recording and what they're posting and how they're sharing it. Like there could be peaceful protests, and then they could just be getting photos or like just footage of people acting crazy, and then that's kind of the picture that people see. Going back to these people that are supporting these like small organizations, isn't it crazy to think that it's probably these big corporations that need these people that work like these laboring manufacturing jobs, and they're like, it's affecting my profitability, so I need to figure out a way for them to protest, so where it doesn't look like the corporation wants them to go back to work, it's where the employee, where the people that work there want to go back to work.
Yeah, it is.
It's all strategic. Like people are not thinking,
and a lot of people like to like be like, oh, this is a conspiracy. But here's the thing. We're humans. We're all humans. It's a human element. You know what I mean?
And we live in a capitalistic country.
Yeah.
So
it's
this
you gotta
is affecting us.
You got to find the string.
Like people are not thinking like how it could even just, not that it's a setup or a conspiracy, because I think people hear conspiracy and they think like, oh no, it's just two guys. No, there's strategic planning around everything that is happening.
Money moves, right? You got money. Dude, you know what? On the YouTube video, it's documented. This guy, and I don't know the names, but basically, this conservative, alt-right, I think it's a Republican, like really strong conservative Republican, was saying, well, he said, anyone who wants to protest right now, we have we have a backer, an anonymous backer who is willing to pay the fines for getting arrested for protesting and disobeying shelter-in-place orders. He said that to the followers. They said, anyone who gets a fine will not worry about the fees. So con más ganas, dude. I mean, I'm telling you, millions of dollars, like, which is like a fucking like drop in the water.
And not even to be like, I don't even mean to be offensive towards these people, but they're almost like pawns. It's like they're calling these other people are calling
manipulated.
And they're like calling the shots, and some people are falling for it, right? And the thing is, like, if you're going to protest, I totally understand that, because that is your right in this country. And we live in a great country. The thing with that is when you have guns, like, showing up at a protest. Yeah. Like, that could get out of hand. Like, I'm not saying you can have guns and things like that, but not you. Why are you taking them out in public? Like, that's very intimidating. And maybe that's the end goal. But
I think, that was the wrong approach.
It's like you're protesting, like, about
you don't need it. You don't need
it. What really is the gun part of it, you know? It could get out of hand quickly. That's the thing, and it's unsafe.
It brought something up to my attention. It was like, if there was black people doing that shit, I was like, that's fucked up. How simply, like, if there was a group of black people with that same attitude, they would have totally handled that situation in a different way, which is infuriating, because you're like, that's crazy.
A lot of people were bringing that matter up, and I don't know. I think it's different. It's just different. I think it's the country that we live in, and it is hard to like talk about that situation because it is very real in our country. And I understand that it could have probably been a whole different situation, just depending on like the culture and the people that would have been involved in that type of protest.
So going back to coronavirus, do you feel like, what do you think about this whole lockdown? Like should we still be following it? How are we handling it?
It's hard to say, because we still have to like continue to live our lives. And I don't know, I think it's like it's just because I don't know, because it's so hard. Like, I was doing it when I came back from Michigan. I had to quarantine, and I quarantined for 2 weeks here on my own. And
But then you didn't have a like enforcer, right? Like a police officer or someone like
no,
from
I
the
just
travel agency or
I
something.
looked up I looked up the resources. I went to like the websites and all of that in the county, and
Yeah.
it advised to quarantine and things like that. So I quarantined, and after I wasn't sick. I wasn't showing any type of symptoms. I just started to interact with other people, but I don't know. I mean, I've been out in public areas and I try to keep like my distance, or like you said, when you got here, you like scope out and you ask people, like, and people are honest. I don't think people, well, like the people that I hang out with,
Yeah,
like,
no, no,
they
of
tell
course.
you, well, I don't have
Because some people don't even consider a small cough to be like something alarming. They'll dismiss it like, no, it's nothing. It's a small cough. Yeah.
It's just different. It's really hard to say because I'm not gonna go to the mall either,
Yeah.
where there's so many people. Like, I'm not also gonna put myself in situations where there's congested people. Like,
Yeah.
even I've gone to restaurants and, excuse me, I'm really impressed with the way that they're handling
Yeah.
their things, because the tables are like separate. There's like only 25% of people are allowed
Capacity.
into restaurants. Yeah, so they're following protocols to the T, and it makes me as a consumer feel safe. And a lot of like like beauty salons and
Yeah, they're
hair
following
salons,
they're
barbershops,
like proper
they're
preventative
going
measures.
by appointments.
Yeah.
And they're using disposable menus also. So
I think if
they're handling it correctly.
Yeah, I think if this whole like if we had a population of people in the United States, if the entire population was generally had that reputation to practice really good hygienic values, I don't think they would have enforced it. I know in Norway or in Sweden, they didn't even have to enforce it, and people just took that common courtesy to their own extent. But that's the issue, is that a lot of people don't have that common courtesy here. Like, we have that issue where people are sneezing in their hands regularly. Before this whole pandemic, I have a practice of sneezing in my shirt. That's out of practice. Mm-hmm. That's not even like I'm trying to watch out. I think it's disgusting when people sneeze. To a certain extent, I think this is disgusting. I think that's disgusting. Like, you sneezing here, you're probably gonna have rub someone. The reason I like to do it inside my shirt is because it stays there, and a lot of people are like, "That's gross. It's inside your shirt." But the thing is, it's to myself, so you don't have to worry about it. And that's the problem, is that people don't have this normal sense of hygienic values, which is why we have to, unfortunately, have someone with a gun forcing us to say, "Hey, you can't do this. You can't get close to people." Because if people, when this whole pandemic shook out and people were like, "Hey, you know what? I don't want to get close to people," and you would see that normally, obviously we don't have that enforced, but we need people with guns, unfortunately, to have people, not me, like I'll do that myself, but there was this guy, dude, I went to USPS, I think this is the second week of the pandemic, the lockdown. I went to the United States Post Office, and there was this, he was like old guy, 60, 70, maybe 80. There was stickers on the floor saying where to stand, right? This guy was a foot away from me. I turned around, I'm like, I look at him, I have a mask on, right? And he looks at me, he's like, "Oh no, don't worry about it." I told him, I didn't say anything because I didn't want to be an asshole either, but I just turned around, I was like, "God damn, like, it's people like this that make people like me tell people like that to say, 'Hey dude, fucking step on the sticker. What's wrong with you?'"
I think that this situation has made people act
Take about 5
in a
minutes.
different way. Like, they act differently, and I think it's good to take the precautions, of course. But at the end of the day, like, when is the right time to start normalizing things anyways?
I don't think it's gonna go back to normal.
I mean, isn't this really good anyways?
Yeah,
like, things
yeah,
are a
yeah.
lot cleaner. We were ignoring
We're
a lot
aware.
of these things before. Like,
Yeah.
now it's an actual thing, but it even, I think it's not gonna be okay until there is a vaccine. So what, like, stay on lockdown like the rest of the year, or as long as they're keeping these policies in place with like the 6 feet apart and the restaurants, the capacity levels, like,
Well, right now, the beach. Have you seen the beach? How full it is? There was a fire actually this morning at the beach. One of the condos burned up. I don't know if you saw it. Because of a lightning strike. It recently rained here like really hard, like this morning. But at the beach, we live in South Texas, and I think we're an hour and a half away from it's called South Padre Island. And the moment the island was opened up to visitors, it got packed. Like, there was a 3-mile line to get into the island itself. Right now, hotels are at capacity. Like, hotels' parking lots are full. That is not the proper procedure. And I'm going to be honest. Look, my wife, she works at the hospital. She wants to go. She mentioned it, just to mention it. Say, hey, what do you think about going next month to the beach and staying there? I was like, bro, do you pretend that there's no pandemic happening right now? Like, what's wrong with you?
I think
she's
that's
works at the hospital.
But don't you think sometimes people are making it a little bit bigger than it is? Like, it is something serious, and like I told you, I am taking it seriously.
Yeah.
But like, if I were to go to the beach, like, I want to go like to the beach, but I'm not going to be like super close to people either. Like, it's a wide open space. I'm not trying to stay like at a hotel or anything like that.
I think that's fine. But here's the problem when it becomes a problem, which is we want to always think about ourselves. Like, I don't think it's a problem if I go to the beach, but what if 300,000 people thought that the same day? When does that become the issue?
Dude, if it was packed and I would not even wait in line for
Exactly.
I would
And that's
just
what I'm
drive back.
saying.
I'd be like, nah.
The sheer fact that you see that line, people should have been turning around.
Yeah.
And that's my point, is that because people don't take this thing seriously, it's gonna right now. I know a lot of people are like, well, hey, the numbers are down and they're chill and everything's been actually going down. Why?
Because they were in lockdown.
Exactly. Because just the sheer fact that we're all wearing masks affects like drastically the amount of infections going. The sheer fact that we're spacing out, there's limits to capacities, washing hands. Just the fact that we all got scared about our hygiene makes a huge difference. There's going to be a big spike again. I'm pretty positive. I'm positive about it. They have graphs. They have outlooks. The CDC, I think they're not showing good, and they're back up because people are going off of what, hey, with good numbers, let's go back out. It doesn't matter. It's going good. You know what I mean?
Yeah. I think it is something that people should be taking seriously. And as long as you're practicing like safe practices, you should be able to be out and about, but with safe precautionaries. If you have to, if you don't have to, then
I take civil liberty like serious. Like the whole like, hey, you shouldn't be forced to stay home.
Yeah.
But at the same token, I understand how I don't trust the public either.
Of course. I mean, it's more but we're risking our lives every day anyways.
Yeah.
When
And
you're
I think
getting in a car, so
I mean,
there's a lot of risk,
Yeah.
you know. I just think people need to be safe and respect other people's like space. Like,
Yeah.
you know, that guy,
Yeah, no,
he should have
of
been a
course.
little bit respectful of your space, right?
Fucking
That's it. Like, so
viejito,
when you go out in
old man.
public, I don't like handshake people or anything. I'm like, hey, I'm like not trying to be offensive, but let's just keep our distance. Like,
I
hey,
haven't
we
shook
didn't
his
even
hand. Yeah, fucking fist bump or like.
Yeah,
side
it was
shot.
just like that.
I can't, dude. I
So-
can't. It's just taking that proper,
safety precautions.
just being aware.
Yeah.
Like we can't ignore it. It's not something you can't just be like, oh, it's gone. Until there's a vaccine, I'm gonna go back to normal. Until I can take a fucking shot and be like, okay, I'm good for this year. I'm gonna go back to normal.
I don't. Yeah. How much time do we have?
I mean, whenever you're ready.
Well, how much time do we have?
We are over by 7 seconds.
Okay.
No, it's up to you. You can.
Well, I was
I'll
just
let you
gonna
take it.
mention like with the whole vaccine thing too. Like, I'm not one to take vaccines. Like, if
Oh,
I
you're
had
one of those. You're
That's
one
the
of those, Karen.
I've never taken
Fuck,
like a.
bro, you're gonna get shit on.
No, that's what I'm saying. Oh, vaccines. Like, am I gonna take it and put it in my body? Like, that's a whole nother thing too.
Do you know the
like,
science behind it?
it's a whole thing. I'm not gonna. We don't have time for it. We don't have time for it. But I'm not gonna put a hint of that virus inside me so that it could be. I'm like, maybe
Well, you know how herd immunity works, though.
I know how it works. That's what I'm
Okay,
saying.
I'm
But
sorry,
I'm not
yeah,
gonna
yeah.
be putting. I don't know if I'm gonna. I barely even take medication. I've never been to the hospital. Like, I'm one of those where I would probably be like, if I got the virus, I would really. I don't know. It's a whole thing. I don't know how I would handle it, but I don't know if I would.
Vaccines are good for you, man.
Is that how we're gonna end the podcast?
Look, we disagree on that. Obviously,
Don't get me wrong. Like, I'm not saying there's certain vaccines and certain medication that I really need to be
No,
aware
yeah,
about.
but
before I
vaccines
put
in
it
general, though,
that I put it in my
they're
body.
good, dude. Fucking look, my son. Okay, that's another fucking.
That, I just was gonna
yeah.
say, you said a vaccine, and like I still don't know if that would make me feel comfortable.
Yeah.
Like, it, it doesn't matter. I think we just still need to practice. Safe
Although, I mean,
practices.
it's a big thing. Well,
It would give me some ease. I'm not gonna say it wouldn't have an
no,
impact.
like
I'm
I
like,
still,
okay, cool,
I still
there's
have
a
those
safe-
practices. Like even with the flu vaccine, like I said, I sneeze in my shirt. If someone's coughing, I don't like any.
Yeah,
clothes.
it's like we
I
still just
don't
have
wanna,
to be aware,
yeah.
like, of anything.
Yeah, no, you're right.
You know what I'm saying?
I don't want to get sick. That's the thing. I just don't want to get sick.
I don't want to get sick either.
Yeah.
I hate getting sick. I
No,
try to
and
avoid that.
if everyone had that, drastically we'd go down.
Take your vitamins. Drink your
You need to
immune
fucking
packet.
fast. That's what you need to do.
We can talk about that.
Yeah,
could
we
be
do.
in our next
Okay.
podcast. But
I'll let you. Who took the last one? I did.
Yeah.
No, I think you took the last step. I said goodbye.
Yeah, I can say goodbye.
Go for it.
Okay, we are signing off from our podcast about the pandemic that's happening with COVID-19. We hope that you enjoy this content.
Thank you. Tune in next time.